Today on Ask the Expert, I am here with Dr. Gretchen Kenshin, and today we're going to be talking about sleep apnea. Now, I know you're wondering, why are we talking about sleep apnea at a dentist office? Well, Dr. Kenshin, let's talk about that. Why is sleep apnea a concern for you here at the dental office?
Well, when patients come in on a regular basis every 6 months, we're actually looking inside the mouth. So one of the biggest risk factors for sleep apnea is tooth wear. So when we see a patient who's been clenching and grinding and we see that wear, that can be a strong indicator there could be some kind of airway issue.
Gotcha. And then also, too, snoring. That's a huge indicator, isn't it?
It is. And a lot of people, think snoring is just a cute way to make fun of their spouse, on video recording. But it can actually be a serious indicator, of something a lot more critical like sleep apnea.
Wow. And so when you start working with a patient, you're looking in their mouth and you start seeing these indicators, do you talk to the patient about that? Do you consult with them at that point about how their sleep is doing, and then do you refer them, or how does that work?
We do. So, sleep apnea basically means when there's usually some kind of structural issue that causes the airway to be restricted. And it can actually cause a person to stop breathing, which is not good.
Right.
We all need oxygen to
It's kind of important.
And a person who is snoring is not a healthy person. So we make sure that we work with the patient to help them get set up for a sleep study so they can get a proper diagnosis.
Very good. And then how long of a process is that, too, to help fix that?
Yes, so the good thing is most sleep studies are done at home. Most insurance companies cover it.
Yeah.
And if you do get a diagnosis, it doesn't always mean that you're hooked to the CPAP machine, which is the tubes that pushes the air. There's other options with sleep appliances or even some surgical procedures that, can resolve the issue.
Wonderful. It's good to know that you're looking out for things like that, too, with these patients. Where do people need to go to find out more information or to schedule an appointment with you?
So I would love for you to check out my website. It's gkdentalcare.com. Come in, we'll do an assessment to see if you may be heading down that pathway to sleep apnea.
That's right. Well, thank you so much for having us today.
Thank you.